order, and then you head over to the condition that it's based on. So I'm going to use an example of a drug that I know comes into play every once in a while. And again, you don't need to raise your hand, but there could be one or two of you in the room who might be on Coumadin. Just saying, maybe. Or warfarin. Anybody ever hear of those names? Okay, I'm getting some nods here. Anybody want to help me find what page Coumadin might be on? Or what it says next to it? Oh, don't be shy. What'd you say? Page 48? 40. F as in 40. The other 40. All right. Everybody go to page 40. And can you tell me where it might be on that page? Is it on the second column on the right? Yes. Page 40. Go up just a little bit higher. Right there. So the bottom right on page 40. Warfarin is the generic that's covered. It's the generic of Coumadin. The generic of warfarin is tier 1. What if there's someone in the audience here that said, I am allergic to warfarin. I have worked with my doctor for 7 years. I must take Coumadin. What would they need to do? No substitutions, and you would need to work and do a coverage determination form with your doctor to get the Coumadin in lieu of the warfarin. Does that make sense? Because that's what's covered. And will you pay the generic copayment if you get Coumadin approved? Very good answer. You will pay the brand name, or if it were a non-preferred, you would pay the higher level of copayment. Wow, smart. Like it. Thanks, guys. So in terms of this, that's a simple demonstration that we did. Some of you, the list of your drugs takes 5 minutes to go through the book. I understand there are others, it could take an hour. We will obviously be here after the session to go through it with some of you, or as I said, your homework will be, when I talk about communication, one step, but the other step will be looking at the formulary booklet, looking at the drugs, or helping others to do so. I know there's some family members here, and pay attention to where the drugs are in there. Put a sticky note as well in there. Helps you mark the pages. Yes? Yes. Yes. So the question is, I currently have a prescription for a particular drug listed in the formulary, and I currently get it for 90 days. However, on your formulary booklet, it's listed for 30 days. In that situation, you would need a coverage determination to request the 90-day supply or greater. If not, you would be filling the drug at the retail pharmacy on a 30-day basis, or getting 30 days at a time. So we can talk about the specific medication, obviously, when we're through today's presentation and the coverage determination form, but that does happen. Some drugs are not. I'm going to give certain drug categories that you might come into play. Don't raise your hand again. Some of you might be on a statin, okay, for cholesterol. Statins often require blood liver testing, correct? All right? Some folks and seniors weren't necessarily checking in with their doctors as often as they needed to and had other drug interactions and complications. Now doctors are going back to, I need to see you every 2 weeks, every 3 weeks, every month. So some of those drugs won't be written for 90 days. They'll be written for 30